Hello, everyone. My name is Michael Wright, a student physical therapist assistant at Nash Community College. And today I'm going to be talking about healthcare of tomorrow. Specifically within that, going to be talking about using virtual reality to help with pain management in the physical therapy setting. Now, this was kind of first brought to my attention and piqued my interest when I was working as a technician at a clinic called Breakthrough Physical Therapy. Um, they were one of the only clinics I had ever been to that I've seen use this kind of technology, and I saw some great results with it. It was kind of something that the patients um, were presented, and if they liked it, they could use it. And again, after using it, they could keep using it if they wanted to. So that's kind of just how um, I became interested in this topic, and I think you guys will too. So the first slide talks about how adherence to treatment is important, and how there are barriers that pop up that we as PTAs need to be aware of and be able to help um, get rid of some of those barriers. So first I'm going to start with defining patient adherence as it applies to healthcare setting. Um, Patient adherence is the extent to which a person's behavior corresponds with the agreed recommended recommendations from a healthcare provider. So I think you can just see how that's important. We want our patients to agree with and go along with the things that we are recommending for them. It's huge. With every patient, we want to strive to make that adherence to our specific treatment as high as possible. This helps us attain that best outcome for therapy, helps get those patients back to that highest level of function that is possible for them and for that injury. One study suggests that patients' non-adherence to a treatment and their exercise performance had a correlation of up to 70%, which is huge. Again, it's the better the adherence, it seems, the better the outcome, and less adherence, the less ideal outcome. It's pretty simple. They also believe that poor adherence has implications on the cost and effectiveness of treatment. Honestly, two of the most important things: cost. Everyone's worried about the cost, whether it be the patient paying or the company having to pay. And of course, we strive for that most effective evidence-based treatment that we can give those people. And again, we're going to encounter these barriers. And in the physical therapy setting, pain, perhaps the biggest barrier, or one of the most important barriers. Within physical therapy, the level of adherence and these barriers can affect the level of attendance of the patient to their scheduled treatments. Following the advice, of course, we want them to, follow what we say. And it also has a role in them participating in the exercises that we prescribe for them, whether that be in the clinic or a home exercise program. It influences them performing these exercises the correct way with the safe and correct technique that we have described to them. And it also affects them doing more or less than we want them to do, again, either in the clinic or at home. All of these things are so huge. It will affect their outcome. Like all of these things can influence whether they get better or not, and we need to pay attention to that. So again, pain, huge barrier. No one likes it. It's usually a red flag to people, and even even animals. It's a red flag. Stop what you're doing. That's causing that pain. However, in the medical and physical therapy setting, sometimes our patients will be subject to pain, and that's something that they have to deal with sometimes. And we'll run into patients who who, yes, can push through that pain and can continue to get better, but there's some populations that even the smallest amount of pain, they have to stop and they won't continue if they know that it's going to cause pain. And that's again where this virtual reality can come into play. A lot of the therapists at Breakthrough where I worked, they would suggest this to patients if they weren't able to up the weight or up the rep count or start kind of more complex and difficult exercises due to this pain. They would suggest this to patients to use it as a tool to kind of help move them along in their program. And more times than not, the patients loved it and they wanted to continue with the virtual reality sessions along with their exercises. So a little background on virtual reality. I'm sure you all have experienced it, read about it, maybe even own one yourselves, but of course, originally meant for entertainment purposes, state-of-the-art technology, fully immersive headset that tracks your head movement. So if you look left, right, up, down, it tracks that, and whatever setting you happen to be looking into, you will be looking the same ways as your head is going. It's very cool stuff. It can be very fun too. There's some very advanced programs and models of VR. They have multimodal approaches such as they'll have tactile, auditory, visual, of course, and even olfactory components that play into how immersed and distracted these patients are. And as we go on, you'll see that level of immersion is really the key to this working and it even being implemented in the first place. It's really the main thing. And again, just the background kind of with VR and the research of it. Hunter Hoffman, one of the earliest kind of researchers of this, he began his research in 1996, but published his first paper about it, about VR and pain management in 2000. And I believe he was specifically researching it with burn wound victims and treating those kind of wounds. Again, something that we as PTAs could run into. Now, VR and PT. So in the past 10 years, it's really been applied to a lot more clinical settings and areas rather than that burn wound care. Some of those are, again, pain management, acute and chronic, physical rehabilitation, and treatment of psychiatric disorders. It's been most frequently studied in medical settings as a way to attenuate the pain perception, anxiety levels, and just general distress of the patients during painful medical procedures, such as wound care. Again, another thing PTAs we will do, and others like chemotherapy and dental procedures. But again, I just wanted to kind of show how versatile this is, and it can be used across many settings. BehaveVR was the kind of specific program and company that the clinic I worked at were partnered with. I got to experience this myself. I got to see a lot of patients use it, and it's really just a good program to kind of highlight on to give you a sense of kind of what this does. So they use a multi-session approach. So it's not just one and done. You're educated along many different sessions. You build upon what you learn in the beginning. They want to teach the patient active coping strategies, active coping through stress resilience and emotional regulation. Again, all those things kind of feed into that pain perception. So it's important that we can regulate and somewhat control these. this active coping ability to become resilient to stress is extensible across a large amount of physical and even behavioral health conditions. Again, the physical conditions, coming back to us at physical therapy, um, uh, the pain, their pain and neuroscience education, like within that VR, it's a progressive, personalized conjunction with that stress resilience, non-reactivity, and emotional regulation to help activate the patient's parasympathetic nervous system. So parasympathetic nervous system. So instead of, the kind of fight or flight that might come from experiencing that pain, we're trying to activate the opposite. We want that parasympathetic nervous system to be dominant during this. And these VR programs, whether it be through distraction, taking them off into their own kind of fantasy world, or whether it be educating them about breathing techniques or other things that kind of help them come under control of this pain regulate or pain perception. That's kind of their goal with that. And lastly, I'm going to be talking about some theories and research that have kind of given ground to using VR. The first being the gate theory proposed by Melzack and Wall, which suggests that factors such as level of attention paid to the pain, the emotions associated with the pain, and the past experiences with that pain all play a role in the way and intensity with which that pain is interpreted. So again, we're using that VR to control those emotions, to control that level of attention, take the level of attention down from that pain, and try to forget about those experiences that might be associated with that pain. Again, all to just bring this pain level down. Another, McCall and Malot, expanded on this gate theory by stating that human beings have a limited capacity of attention, and that the individual must really pay attention to that painful stimulus in order for it to be perceived as painful. Some of you might have heard that, pain is all in your head, and there's some validity to that. Our brains are powerful things, and if we're able to kind of regulate and kind of bring this under control, that level of pain can be brought down a lot. Again, this VR is overall it's used to distract and to give these people coping mechanisms, all to bring that perception down, that pain perception down, less intense. Another kind of theory called the multiple resources theory, suggested by Wickens. It kind of gives some more background to the multimodal approach of the VR, that being the visual, auditory, tactile, and olfactory components. That theory suggests that the resources in the different sensory systems, they function independently. So they're independent, and they all feed into this, what they call the pain matrix. So the emotions independent, the emotions and experiences with that are kind of all independent. So if we can block or limit the flow of these pathways to the pain matrix, we can greatly reduce that pain level. All right, that's kind of the end of my presentation. I hope you all found it interesting. I'm excited to kind of continue looking for more research done on this topic. It's still, even though it started back in 2000, there's still a lot of ground to be covered. A lot of this research is really addressing that acute pain and the treat that's brought on by the treatments and the wound care. It's really right now being studied for the chronic pain management of some of these other disorders. And I'm very excited to see where that goes in the future. And I think it's got a promising future. Thank you all for listening, and I'll see y'all in class.